I look at my health and think it's the most important thing. But there's one thing that I always forget to look at is my gut health. Now, is gut health really a fad or is it really true? My next guest has written the book, Is It IBS or Is It a Diet? Now, that's where we get to dig in a little bit deeper. This guy that I have here, Mohammad Fariva.
Creating curiosity by asking better questions. This is Shed Talk.
Mohammad, welcome to Shed Talk. And you know what? I just want to say thanks for coming on. We had some technical difficulties getting on before, but now greatness survives with us. And I want to jump right in. What is IBS?
Okay, Kevin, thank you. And nice to meet you, Kevin. And thank you for having me. Irritable bowel syndrome, basically, what they call it irritable bowel syndrome is combination of having too much gas and bloating. So if you have a lot of gas and bloating, as a result, you get a stomach ache, you pass gas, you get diarrhea, you get constipation, frequent bowel movement, basically change in bowel, form of the bowel, sometimes even urgency, and sometimes fecal incontinence. So in other words, goes from one spectrum of bloating and gas and, passing gas frequently to the spectrum of losing control and soiling yourself. So that's what's called irritable bowel syndrome. But those are symptoms that are related to our diet, okay, related to what we eat. There is no such thing. There is no disease. I've been in practice for 52 years, and I've seen thousands of mistreated and misdiagnosed patients with irritable bowel syndrome. And it's mostly female, mostly kids, and so forth. Most men don't complain about irritable bowel syndrome. They have gas and they're bloated and they just go and pass it and get going and they, live their life. But women, every day that I see about 12 patients a day in my practice, and out of the 12, 3 or 4 of them complain about irritable bowel syndrome. They are there because they've had this problem and they have been to 3 or 4 doctors, 3 or 4 different hospitals and institutions for that. So it's a common problem. In the United States, 1 out of 7 people complain about having irritable bowel syndrome. And it has become such a huge market, which, is a dark market really, because you go on the internet and you say you have IBS, and everybody, they won't leave you alone. Every day they come up with the new probiotics, new prebiotics, new enzyme supplements, new foods, new supplement, new webcams, uh, labs that offer you testing your hair to see what's wrong with you, testing your blood to see what's wrong with you. So it's an amazing dark market really. And so I have written the book, Is It IBS or Your Diet? Because IBS is all related to you. There's the symptoms of what you eat. Okay. And so as long as you continue to eat what you eat, you're going to have those symptoms. You will never get better. You will always have the symptoms. And it's not symptom of having a disease. It's symptom of eating good food. So the good food that we are eating. So, but you eat, cheeseburger or Kentucky Fried Chicken. I don't know whether you have it in Calgary or no. But you eat any of those things, you're not going to have IBS. But you eat a nice bowl of salad, which is, onion in it and broccoli and those kind of cabbage and everything else in it, you're going to have IBS symptoms. So it's the good food that we are eating that is causing those symptoms. So my recommendation usually to my patient is that, listen, there's nothing wrong with you, first of all. Is your diet and is the good food that you're eating, but you're overdoing it. So just first educate yourself about what's causing your symptom. Know that these are the food that they cause your symptoms. Eat them for sure, but moderate. So one day, and those especially, a lot of them are vegetarian and they're newly vegetarian and they're people who want to lose weight and they have turned into those fad diets. It's not fad diet, it's a good diet. I mean, I don't want to discourage people not to eat those because they're very good for our health. If we get a chance, I'll talk about it and why they're good for our health. So they're very good for our health, but We have to pay for it. There's nothing free in this world, right? Whatever we do, there is a there is a price for it. So we want to feel good, we want to be healthy, we want to live long. These are the food to eat, absolutely. But there is a price for it to pay. We are going to get bloated. We are going to have discomfort. We are going to have diarrhea, and depends on the frame whether your frame is a small or large. Symptoms are different. That's why I say this mostly. I mean, I practice in Cambridge, Massachusetts, in one of the Harvard hospitals here. And most of my patients are thin, educated females. And these are the people that they complain because they eat healthy. They eat a lot of those foods and they get bloated and they get gassy and they go to work and now they're gassy and they're sitting and they can't pass gas at work. And so they're having pain. And then they go from one doctor to another, having one colonoscopy after another. And, I have seen patients for 18 years. They've gone to three different major Harvard hospitals here, been seen by the biggest names in our business. And nobody ever asked them, what are you eating? Everybody did colonoscopy and endoscopy and blood test and stool test and told them there's nothing wrong with you. And of course, there's nothing wrong with them. And go and get probiotics, and they give them prescription for like muscle relaxant and pain medication. And they'll never get better because the problem is what they're eating. And so that's why I wrote this book. So my idea, Kevin, that the reason I came on the podcast on a short notice too, is not to sell my book, is to educate people that they don't spend. Last year in this country, in the United States, and I'm also sorry about what's going on with our crazy president in this country, really. So in the United States last year, 20 million people saw gastroenterologists for IBS. Okay, if they were educated, they would never do that. And $40 billion in B was spent by patients themselves and by healthcare costs on these people for no reason, really. So what I'm trying to tell people first is that there's nothing wrong with you, that this is a normal reaction to what you're eating. And second, I'm going to tell them what they should do. So I'm going to now, I spoke a lot. Maybe you want to ask something. So I'm going to wait unless you want me to keep going, and then I'll keep going.
No, I really enjoy what you're saying because it has a great flow. And what's really interesting, when we talked about at the beginning of IBS, as in the black market, because it's $1 billion industry, and I don't mean black market, it's a bad thing, but you were talking about
Well, it is a
everybody.
dark market. It is. It is
Yeah.
a bad thing.
And
Absolutely bad thing.
and
It
then you
is a
start
bad thing
hearing
because
about, yeah, everybody wants to sell all these widgets and gadgets that you got to have it, but let's get it down to the basics, like you said, it's the diet. So I'm
right,
going to let you,
right.
you know what, keep rolling with that.
Okay, I'm going to keep rolling. So, so it is the diet, right? And we can find out also specifically what is causing our problem, which food is more responsible. So there are a bunch of foods that they are called high in FODMAP. FODMAP is fermentable oligo, and monosaccharide and polyols. In other words, carbohydrates. Carbohydrate that we don't have, everything that we eat, apples, pears, uh, watermelon, dry fruits, cherries, garlic, onion, Brussels sprout, cabbage, beans, plantain, whatever. Everything that we eat in those categories of healthy food, they have non-digestible carbohydrates. In other words, we have enzyme to digest a lot of carbohydrates. Okay, we have enzyme to digest it and we digest it. Some of them, God created us and created those bacteria in our intestine. The bacteria is our best friend. They are the best friend in our intestine. They are the source of vitamins, the source of energy for us, the source of us feeling good. They are anti-inflammatory. They are the best organ that we have after our heart. Probably we need our heart to live, and then we need those bacteria. So the bacteria are the best source. So there is food for them. There's food for them to get to them, and so they can eat the food. They can produce energy for us. They can produce short chain fatty acid that they are signal between gut and brain that makes the brain tell the brain to make hormones. that keeps us awake, keeps us happy, antidepressant, anti-anxiety, and so forth, and also produces calorie. So one thing that we don't realize is a lot of people that they want to lose weight. So I go from one spot to another. A lot of people that they want to lose weight, they eat salad and they come and say, Dr. Farivar, I'm eating so much salad and I'm not losing weight. I says, honey, have you seen cows? They say yes. I said, well, sometimes they're a ton or more. And I said, they're all they're doing, they're eating grass. And there is calorie in grass that we eat. Okay, cows and ruminates like cows and sheep and those things. They have their colon at the beginning of their GI tract in their rumen. So, and that's why they keep eating and re-eating things to make it smaller, so these bacteria can eat and produce calorie. And for every gram of grass that we eat, the bacteria, they produce 2.5 to 3 calories for us. For carbohydrate is 4 calories. For fat is 9 calories per gram. So there's nothing for free. So those bacteria they ferment the food that didn't get digested. Okay, so fermentable food. Ferment the food that didn't get digested, went to large intestine, and fermentation produces one of them. In addition to good things that produces, also produces hydrogen, carbon dioxide, methane, and so forth. So the hydrogen gets into our bloodstream and comes out of our mouth when we breathe. And that's why if you're bloated and you go to bed and in the morning you wake up and you haven't passed gas, you're going to sleep, but it has come out of your breath. Now, this hydrogen is measurable. We can easily measure it and see what kind of food is causing problem for you. It's called hydrogen breath test. Now, this is not being done in doctor's offices and the hospital. Rarely there are doctors, very rarely, maybe 1 in 100% of doctors, and maybe, probably less than 10% of the hospital may have equipment to do hydrogen breath test, which is very easy. And you know why not? I tell you why. Because for hydrogen breath test, the insurance, Medicare this year, I just checked it, they pay $67, okay, for doing a hydrogen breath test. The equipment is $4,000 or $5,000. The material you have to give it to the patient is at least $10, $20. It takes 3 hours to do it. So you need a technician to do that. No doctor is going to take that long and do hydrogen breath tests, even if they know this is what they're supposed to do. A lot of them, they don't. But even if they know it, nobody, me as a gastroenterologist, I'd rather do 4 colonoscopy and get paid $4,000 instead of getting paid $67 that I have to pay at least $75 to my technician that sat there with the patient. So unfortunately, this is one of the shortcomings. And that's what I'm trying to educate people, that when you go to the doctor and you see your doctor, if you have IBS, the first thing you ask about, if they say they want to do colonoscopy, say, no, doctor. I don't have any problem. I haven't been losing weight. I don't have blood in my stool. I don't have family history. I'm young. I'm 22 years old, blah, blah. First do breath test for me. So when you do breath test, you can find out if patient has lactose intolerance or no, if they have fructose intolerance. Lactose is a sugar in milk and dairy product. Fructose is a sugar in all the fruits. If they have SIBO, a small intestinal bacterial overgrowth, if they have rapid transit, if they have pancreas insufficiency, and if any of the high FODMAPs is the cause of their problem. With the breath test, you can find all of these things out, but it's not being done. So I'm trying to really talk more about this issue and tell people that, one, it's not, you don't have a disease. You are eating too many good foods, and all the power to you. Keep eating it, but don't complain then. Eat as much as you want to, but don't come to tell me that I'm bloated, Dr. Farivar, and I'm having cramps and so forth. Cut back. I mean, you don't have to eat beans, with every meal, as people are doing. One of the in my area, we have a lot of South American and Brazilians, and they're great at eating rice and beans. And so they keep complaining, and that, oh, I am bloated, I'm this. I say, okay, well, lay off your bean and eat less of that, and you should be okay. So that's the problem. Anyway.
Hey, take a minute and smash that subscribe button, and let's get back to the episode.
So if somebody actually wanted to actually get a breath test, should they ask for it? Say, listen, I just listened to this
Yes.
podcast. I want the breath test over anything. Can they actually
They should
have
ask
that
for
done?
it.
And they'll
Yes.
actually get it
Yeah,
done, and it'll be $60?
No, the breath test is the insurance pays for it.
Right.
Insurance pays for it. Insurance pays for breath test. Is a approved test that has been around. I've been in practice for 52 years. I think the breath test has been around for as long as that because I've been doing it for years and years. Fridays that I don't work, I have three little machines that they check breath tests, and Fridays patients come and they get their breath test done. And the front desk person that is not a medical person, you know what I mean, makes appointment and so forth. That she can do it because drinking can of Coke, and Coke has high fructose corn syrup in it as a sweetener. So you have fructose intolerance. 3 hours later, you breathe into this little machine, and the number, if it goes to 20, you have fructose intolerance. Simple as that.
And this is
Okay, not a huge, complicated test that you need to do. It's just as simple as that. Or lactose, you drink a glass of milk and you do that, or other substrate for different foods. So that's what it is.
What's one of the
Yes.
hardest foods out there right now that people are eating that you would say, okay, like you mentioned earlier about rice, and I'm going to go into the fitness aspect of it because people that are in the fitness thing, yes, we eat healthy, they eat properly, they have the proper meals. Is there one carb that would say like be careful of? Like, yes, it's rice. Rice does this. Can it cause any effect with rice, as an example? Can rice
Yeah,
cause
okay.
any?
Rice doesn't cause any IBS symptoms because rice gets absorbed very easily. But rice is no good. I don't usually tell people don't eat rice because then you get fatty liver.
Oh,
Okay, rice get absorbed into our system very easily, turns into triglyceride. Triglyceride is a kind of fat that goes and sits in the liver and just sits there and is having fun there. And then we get fatty liver and cirrhosis as a result of that. So rice is one of the carbohydrates that we should stay away from and not eat much of it because of that issue, not because of IBS. That's a different type of problem. So beans are fine. There's nothing wrong with beans, and you can get rid of their FODMAPs because FODMAPs are water soluble. You soak them in water if you want to use beans and peas and those kind of things. You can put it in a jar of water the night before and even boil it maybe for 2 minutes and leave it there. And the next day, wash it, and you get rid of most of the stuff that is gas producing. So you can eat your beans. And also, the more gas you have, the better off you are because it means those good bacteria they have had food and they've been producing and they've been working in your favor. But tell this to a young woman. I have a hard time telling them, listen, this is good for you. Dr. Farivar, do you have anybody? Can we go to somebody else instead of you? You're telling us I'm okay. I say, yeah, you can. Just go and have another colonoscopy.
yeah, just have it and you're good to go and run free, run free. Yeah.
Right.
So
So
now I'm going to get into as an entrepreneur because you own your own practice, correct?
I used to. I'm retired now, and I work as a consultant for the Harvard Medical School.
So
I,
as a cons
I I used to. I used to own my own practice for 42 years.
and what was your greatest challenge of owning your own practice?
What was the greatest challenge of owning my own practice? Dealing with insurance, dealing with government, all of those. I mean, patients they were pleasures. I never had any problem. I've been in practice for so long, and I've never been sued, even though I've seen probably I've done at least 100,000 colonoscopies. So you just go take it from there. I've never been sued. Never had any complaints against me in the hospital or by colleagues or by nurses or by patients. So that part has been the easiest thing. The part that was always difficult is dealing with insurances that, and I also have a problem right now myself. I see it. I'm old. I'm 80 years old, right? And so I need medications and so forth. And a lot of times doctors write medication for me, and I go to the pharmacy and they want $600 copay. And I say, 600 copay, give me the alternative. And so, and even so, getting medication is become such a hard time, and it's becoming worse and worse. Some patients that I take care of, like Crohn's and ulcerative colitis, and they have come up with a lot of good medication for them, excellent medication. But insurance doesn't approve it. I write the prescription, it goes, pharmacist says your insurance isn't approved. They come back. I have to write a letter telling them this is the best for them. Still, they don't approve. So there's a lot of challenge like this with the government and with private insurance. I mean, everybody wants to, the guy take $14 million bonus in a year. You heard about all of that in New York. And but the patients can't get anything. Okay. And we are in the middle of it. I mean, I, as a physician, I know what to do with this patient. I know what the patient needs. Insurance is not going to do it. Insurance is not going to give it. So it doesn't matter how much I holler and how much I complain. They're independent, they're big. So I shouldn't say that, but I hope that Mr. Kennedy does something good in that field because there's a lot of profit taking in the field that there shouldn't be profit taking. The hospital, they all say that they are non-profit, but they're all for profit because they keep building more building and newer things and the more salaries and more bonuses. So they're for profit. Who are they kidding?
No, you're exactly right, and it's big business, and the drug FEMAs are, well, it's a massive market. Well, like you said, IBS, misdiagnosed, missing the black market. What that is, the trending name of IBS. That how many the supplements is out there? It's like, are you crazy?
So, and you know that probiotics are useless. Did you know that?
No,
No, you didn't know that.
no.
Okay.
Okay.
All the bacteria that is in our colon, they are probiotics. Everything. Okay, they're all probiotics. Each one, when I do colonoscopy, patients say, oh, I lost 5 pounds minimum, or I lost 10 pounds. So each one of us have 5 to 10 pounds of probiotics already sitting there. So we take a gram of probiotic. They say, oh, billion bacteria per gram. Okay, 1 gram. Our colon bacteria is billion per gram too. We have 1 billion bacteria per gram of our stool. Okay, so you eat this 1 gram of one bacteria or two bacteria or whatever it is, and that even may not survive the acid in our stomach or enzyme in our intestine. And even so gets to the colon. Okay, fine. The bacteria is running and getting there. Okay, it gets lost because they drop in the bucket. What's it going to do? Right?
Mm-hmm.
So eating the food that I mentioned, high FODMAP food, that is good for us because that is going to go, and the bacteria, the probiotics that are there is going to feed them. And so they're going to grow and they're going to be better. So the best probiotic, which I recommend to everybody, I'm a yogurt doctor. I tell everybody you should eat yogurt every day. Is the greatest thing because it has protein, high in protein. For people who have lactose intolerance, lactose is gone or been already fermented and has you need at least 4 bacteria to make yogurt. But mostly probiotic yogurt, they have 7 bacteria in it. Like, I've read Chobani yogurt or Activia or Greek yogurt, probiotic yogurt. They add more good bacteria to it too. So you want to have probiotic, by all means, have it. It's great. But eat yogurt. Okay, and if you make yogurt at home, that's even better. That's even better. And to make yogurt is very simple. You take milk and you boil it, and then you add a couple of tablespoons of yogurt to it. You wrap it in a blanket for it's 37 degrees for 24 hours, and then it has turned into yogurt. That's all. That's all it is. And you have your own yogurt that's probiotic that has good bacteria. Uh, so I tell people, or kefir. Do you know kefir?
Mm-hmm.
Kefir.
No, I haven't heard of that.
Oh, is the greatest probiotics around. is a Russian sort of fermented milk that I think has about 18. Let me just hang in there for a second.
And now this is where it gets interesting because we get to see all the unique stuff that we wouldn't even know here. The things you know that you don't know on Shed Talk, and getting the actual fermented yogurt. And here it is.
So
Oh,
you see that?
yeah.
Okay.
Lifeway. Yeah. Kefir. I've never seen that before.
Yeah, this is in all the supermarkets they have it. Okay, and then you got to read it, and it's full of good bacteria. So okay, this a cup of that a day is the best thing for your health. Is the best thing. You have a cup of this a day, you'll be 110. I guarantee it. Don't spend your money too much if you're going to start eating this, because you need to keep it. You're going to live long.
Interesting.
So,
Now, what about fasting? A lot of people fast, right? And so say they go into fasting, and then going into the next part would be what foods should go into the system right after fasting.
fasting is good for our health. I think that's because we are going to burn all the extra uh, glycogen and carbohydrate that we have stored in our system. And also, it wakes up some of our cells and gives them time to repair. And what should they eat after they fasting? Eat whatever they want. I mean, we should be. I always tell people that I advise them to fast and lose weight. I always tell them eat everything you want, but with moderation, a small amount, so you can continue to fast. Uh, you know what I mean?
Hmm.
So I never say don't eat this, don't eat that. Eat everything that you want to eat, eat a little bit of it. So what are you going to do? I'm a Muslim, right? And as Muslim, what we do when we breakfast, we have a glass of hot water and a date. Date is the best thing. Is has a good carbohydrate in it that slowly releases itself. It has magnesium and so forth and vitamins that we need. I mean, that's what we do. And I think that based on times, probably many centuries, people have come up with that's probably the best thing to do. But as far as I'm concerned, it really doesn't matter what you eat.
So, a question for you. I want to ask you about this. Where do you see yourself in the next year? You
Where do I see
personally.
myself?
You personally, because you've been on a lot of podcasts. You're talking about the IBS, your book, or a diet. What is your next year looking like?
My next looking, I'm hoping that I can train people. I can get into enough podcasts and places to talk about this IBS and tell people that really it's your diet that's causing that. That don't keep going to one doctor after another, because as I said, I see that all the time. I see it every day. Don't keep going to doctors. Just educate yourself about high FODMAP food that causes gas, and then know what the low FODMAP foods are. And these are you can go on the internet and you can easily find out. Or my website too. It says GERD, that's GERD, acid reflux IBS.com. So if you click on the IBS part of it, it says there problems that can cause those symptoms and what is high FODMAP and what's low FODMAP. Now, beside that, so this is really my mission. My mission is two things. One is to educate people. Two is to also educate people about when they go to the doctor, which none of them get a breath test done. Ask for breath tests so what is especially more harmful for you in terms of producing gas. Is it milk and dairy products? Is it fruits and fructose? Is it other maltose and so forth? It is sucrose, and they all we can find out by breath tests that which one of them we are having specifically more problem with, or which FODMAP food caused that, or was it the wine or beer or that is causing my symptoms, or is it garlic or onions or you know what I mean? So I'm just trying to educate people about these two issues if I can, as I said at the beginning, I also another one of my webcasts is it IBS or your diet? Is the name of a book.com. Is it IBS or your diet.com? And that information, that book can be read there for free. And also the stuff on my web, grd-ibs.com is for free too. And it's been there for 20, more than that, since 1990. So it's been there for 30 years for people to access for free and get the information. So idea is not really to sell books, is to educate people. And that's what I'm hoping that I can do. I'm also trying to see if I can come up with an easy way of doing this breath test, that it doesn't cost much, so people can do it. Doctors can, can do it in their office without worrying about the prices and not getting much. Or patient they can do it at their home. So that's my next hope.
That is absolutely amazing. You know what, Mohammed? Thank you very much for being on Shed Talk and enlightening me and actually understanding about IBS and really dig deeper into exactly that breath test because I never knew exactly what that was about. I hope you guys enjoyed the show. Smash and like Shed Talk. And you know what? We'll see you on our next episode of Shed Talk. And you know what, Mohammed? Thanks again for joining us.
It was nice to talk to you, really. And thanks, Jackson, too, for that.
Thank you.
Nice talking to you.
Now you know. Shed Talk.